for choosing us for your oral surgery needs. Following are some postoperative instructions that hopefully will help you through a speedy recovery. The gauze you have in your mouth must be directly over the surgery site and should be kept under constant pressure for 30 to 45 minutes. This will serve to stop the bleeding. The package you were given contains more gauze. Should the bleeding persist, you may use this gauze to bite down for another 45 minutes. If this fails, moisten a tea bag in very cold water and bite on it for another 45 minutes. You may expect some bleeding for as long as 24 hours following surgery. If excessive bleeding still persists, give us a call. Strenuous exercise will induce bleeding, so plan on relaxing for a few days. Avoid speeding and sagging through a straw, as this will too induce bleeding. As soon as you get your prescriptions filled, take the ibuprofen 400 milligrams, acetaminophen 1000 milligrams, and the antibiotic amoxicillin or clindamycin. Then continue with the ibuprofen 400 milligrams every 4 hours around the clock for 3 days, and then as needed for pain. Continue taking 2 acetaminophen 500 milligrams every 6 hours around the clock for 3 days, and then as needed for pain. You will take your antibiotic every 6 hours until gone. Even though you may be numb following surgery and you may not feel you need to take a pain pill right away, if you wait until the numbness passes to take one, you may hurt unnecessarily until the medication gets into your system and starts to help. Hold ice packs on the side of your face for the next 48 hours at half-an-hour intervals. The ice packs should be removed for 10 to 15 minutes to avoid frostbite. Additional rest will also speed recovery. This will keep the swelling to a minimum. You will reach your maximum swelling in approximately 72 hours, after which time it'll gradually decrease over the next 4 to 5 days. Although nausea is a rare occurrence, should it happen, it can usually be controlled by small amounts of black tea and blackened toast without butter taken every 4 to 6 hours. Avoid sudden movements and rise slowly from a sitting position. Also avoid having too much movement on the ride back home. Keeping well hydrated by drinking small sips of water will also decrease nausea. Avoid eating or drinking too much at a time for the first or second day to avoid nausea as well. Start out on a soft diet. Mashed potatoes, eggs, soups, pasta, and the like should be your fare after extractions, particularly wisdom teeth. Popcorn and seeds are off limits for at least 1 month. Do not stop eating just because you had surgery. A good oral intake is very important, as you need good nutrition to heal your wounds. You should average a tall glass of fluid at least every 2 to 2.5 hours. Do not use a straw, as this may dislodge clots in the extraction sites, causing a dry socket. Do not rinse or swish water around the mouth for the first day. The day after surgery, you should begin gently swishing warm salt water in your mouth over the surgery areas. Repeat this 3 times for 1 minute for 1 week. You can brush your teeth very carefully, particularly around the areas of the extractions. If desired, you may use toothpaste. Mouthwashes can be started 1 week after surgery. If you smoke, tobacco or marijuana, try to refrain from smoking. Smoke is an irritant and will delay healing, prolong postoperative discomfort, cause dry sockets, and increase your chance of infection. The same is true for alcohol intake, so please also refrain from drinking alcohol. The removal of impacted wisdom teeth and other surgical procedures may be quite involved and difficult. The following conditions may occur, all of which are considered normal. The area operated on will usually swell. The swollen area can become quite large. Stiffness of the muscles may cause difficulty in opening the mouth for a week or 2. You may have a slight earache. If it becomes severe after 4 days, please return to the office. You may not operate any vehicles for 24 hours following general anesthetic or while taking narcotic pain medications. A sore throat may develop. Your other teeth may ache temporarily. If the corners of your mouth are stretched, they may dry and crack. Your lips should be kept moist with a cream or ointment, such as Vaseline or cold cream. There may be a hole where the tooth was removed. This area should be gently rinsed following meals with warm salt water. Begin this the day after surgery. This space will gradually fill in with new tissue. Black and blue discoloration may occur on the face as a result of surgery. This occurrence is a result of blood in the tissue. This occurrence is not unusual and will resolve within several days. Do not be alarmed if the black and blue discoloration gets lower into your neck or or chest over time. This is only the product of gravity acting over the bloods in the tissues. There may be a slight elevation of temperature for 24 to 48 hours. If temperature continues, please notify the office. Bone spicules may work out of the site of surgery for several months following the procedure. Prescriptions refills or new prescriptions are only filled for patients of record during normal office hours, Monday through Friday. Please plan your request accordingly. I hope these instructions were helpful to you. If you have any questions at any point, please give us a call. And once again, thank you for choosing us for your oral surgery needs.